Hi there, my name is Liam Esposito and I have done this video to go over what the options are for missing teeth. Now with you watching this video, I'm presuming that you are thinking about replacing teeth. So in this video, I will go over what your options are, what the pros and cons are, and also some provisional costings. So I'm here, I'm happy to help, so let's get started. Okay, so the first option, number one, is to leave a gap. Number two is to have a denture. Number three is what's called a bridge. And number four is a dental implant. So all the options you can see on my right here. So now that I've established my left and right, we are starting with the pros and cons of leaving spaces and having no teeth. So in the top right hand corner, we have the benefits, and they are no cost, no treatment, and some people can just manage with having no teeth. However, there are some downsides of leaving gaps. The first one is aesthetic issues. The next one is reduced chewing ability. And with there being fewer teeth, the forces are on the ones that remain. So that tends to lead to accelerated tooth wear, which can lead to tooth breakages and issues in terms of that way. The other problem as well with having no teeth is that the teeth do drift, teeth will move, and once you had a space, what you can find is that teeth then start to drift and occupy those spaces, which can be an issue further down the line. Okay, so the first option that I'd like to talk to you that actually replaces teeth is a denture. Now there are two types of dentures. There is a chrome denture that has a metal framework, and there is a plastic denture made of acrylic only. The chrome denture is a lot thinner, where the plastic denture, the acrylic one, tends to be a little bit bulkier. Now dentures are removable. You take them out, you put them in. They do have advantages. The big one is that they are relatively conservative to the remaining dentition. They're also fairly straightforward to make. They are cost effective, so they are cheaper than some of the other options that I will discuss that are fixed. And the good thing with dentures, they can be modified, but there are some downsides, and the big downsides is that some patients struggle with dentures. Some patients just cannot tolerate them. They also are bulky, so they do compromise the remaining dentition, as oral hygiene can be compromised, and this has the effect of accelerating dental disease such as dental decay and gum disease. So dentures are unpredictable, but some patients do get on with them. So bridges. Now this is the first of our fixed options. With bridges, there are two types. There is a resin bonded bridge, otherwise known as an adhesive bridge, and there is also what's called a conventional bridge. So let's look into both of those bridges. So resin bonded bridges, how do they work? Well, they are a prosthetic tooth that have little metal arms that are glued onto the adjacent teeth. Now the great thing with them is that they are very easy to make. They are conservative to the remaining dentition. The downside with them is that they can be unpredictable, and they have an average lifespan of between 1 and 5 years. They work really well on young patients with replacing front teeth, but they tend not to work so well with patients who have heavily restored mouths, in particular with replacing back teeth. Conventional bridges, what's the difference? Well, the main difference is that the teeth supporting the bridge are prepared. In other words, they are cut down for the bridge then to be mechanically locked in place with glue. Now, the advantage of a bridge is that they have a good lifespan. They have an average lifespan of around 10 years, depending on the health and condition of the supporting teeth. The downside with them is that we as dentists have to cut the teeth, and that carries risk. It carries risk of toothache in that nerves within those teeth can become unwell, and the other risk is that when the bridge fails, it sometimes can result in those supporting teeth being lost. So the final treatment option to discuss are dental implants. So dental implants are the closest thing that we have to actual teeth. Dental implants are very versatile. They can support a single tooth, they can replace multiple teeth, and they can also replace a full arch of teeth. Implants can be a fixed option with either a crown or a bridge bolting down onto the implant, but it can also support a removable prosthesis such as a denture. So like a press stud on a jacket, a denture can actually clip onto an implant to help give a denture that bit more support. The advantage of an implant compared to some of the other options is that they have great longevity. But it does depend on the patient being suitable. So a patient needs to be well, a patient ideally needs to be a non-smoker with healthy gums, with good anatomy, and the treatment needs to be performed well for the treatment to have good longevity. So the advantage of implants, the closest thing we've got to a tooth, have good longevity, but there are some downsides. And the first downside is that there is a higher initial cost. Now, with there being a higher initial cost, what we tend to find that in the long term it works out better because implants last. The other downside is that it involves some surgery and it involves a lot of compliance from patients because treatment can take from 3 months onwards depending on the complexity of the treatment. But if fixed is what you're looking for, dental implants is certainly an option to look at. So finally, how much does it cost to replace teeth? So I'm going to give you a very broad overview. So it depends on whether you are at an NHS practice or whether you're a private practice. It will also depend on the treatment that you select. So let's start with implants. So implants tend to be the more expensive option because it gives you that predictability. Now for a single tooth, it can cost anywhere between £2,500 upwards to £4,000. To replace multiple teeth, it can be from £4,000 onwards. And if it's a full set of fixed teeth, it can be from £10,000 per arch. So dental implants in general is not provided on the NHS, and it's important that you are seen by somebody who is trained in dental implants. Costs obviously do vary with implants and any other treatment really, depending on the experience of the clinician, whether they are a general dentist or whether they are a specialist. So looking at bridges. So bridges, it obviously depends on the number of teeth that are replaced. But in general, to replace a single tooth, it can be from £800 onwards privately. For a denture tends to be the cheaper option compared to implants, let's say. But dentures can vary depending on the materials chosen, whether it's a chrome denture or whether it's an all acrylic denture, and costings can be from £300 upwards to £2,000 depending on the design of the denture, the materials chosen and where you have that treatment performed. Now, it's important if you are looking into having some dental treatment for replacing teeth, it is important that you do have a conversation with your dentist to get all your options. It's also important that if you are being seen by a NHS dentist, that you have a conversation with them to see what is covered on the NHS. But some of these things that I've spoken about are not covered, such as dental implants. So thank you for watching this video. If you have any questions, you can get in touch with me. My details are here. I work at Bolmere Dental Practice. My name is Liam Esposito. You do have here my business mobile number. So if you do have any questions, do feel free to ask. I only look at my WhatsApp in my business phone once a day, so I might be slow on the uptake of sending you a message back, but I'm always happy to help. Okay, thanks again. Bye-bye.